Hello, I am Donald Trump and here is the news of the TV station. Today's news is about MRI. When Nikola Tesla first described the rotating magnetic field in 1882, he could hardly have imagined what it would lead to. Just 130 years later, that discovery has become the basis for the highly popular tool of magnetic resonance imaging. At first, it is used to measure the movement of atom, therefore called nuclear magnetic resonance. Until 1971, a doctor named Raymond Damadian wondered whether the same technique can be applied to map the inside of human body and start to build the first machine. Now we talk about MRI's principles, pulse sequence and image quality. The principle of this machine is to make use of the most abundant component in the body, hydrogen in water. These tiny atoms act like magnets, which is sensitive to magnetic field. The first step in taking an MRI scan is to use a big magnet to produce a unified magnetic field. The gradient adjusts the magnetic field to smaller sections of different magnetic strength to isolate different body parts. Normally the water molecules are arranged randomly. When we lie inside a magnetic field B0, they start to align with the magnetic axis B0. The cumulative effect of all the magnetic moments of the nuclei is the net magnetization vector. When a radio frequency, RF, pulse is applied, the RF excitation causes the net magnetization vector to flip by a certain angle, and this produces two magnetization vector components, longitudinal magnetization and transverse magnetization. When the RF energy source is turned off, the net magnetization vector realigns with the axis of B0 through the process of T1 recovery, during which the longitudinal magnetization increases in magnitude, or recovers. At the same time, the transverse magnetization decays, through a mechanism known as T2 decay. Different tissues have different T1 and T2 values. In a RF pulse sequence, there are two important parameters. TR is the time between the application of an RF excitation pulse and the start of the next RF pulse. TE is the time between the application of the RF pulse and the peak of the echo detected. TR and TE can be adjusted to emphasize a particular type of contrast. For example, in T1 weighted image, while the images show all types of contrast, T1 contrast is accentuated. T1 weighted images best depict the anatomy. However, T2 weighted images provide the best depiction of disease, because most tissues that are involved in a pathologic process have a higher water content than is normal, and the fluid causes the affected areas to appear bright. Proton density weighted MR images usually depict both the anatomy and the disease entity, and now is the image quality. The image quality depends on four main factors: artifacts, spatial resolution, signal-to-noise ratio, SNR, and contrast-to-noise ratio, and image contrast. First is artifacts. Artifacts may be defined as the false features in the image produced during the imaging process. The random fluctuation of intensity due to noise can be considered separately from artifacts. Artifacts can be rectified easily when the causes are known. It is necessary to be familiar with specific artifacts since they can conceal pathological elements or simulate pathology that does not exist. Artifacts can be classified into many different categories, such as aliasing artifacts, chemical shift artifacts, Gibbs and truncation artifacts, magic angle artifacts, motion artifacts, point artifacts, slice overlap artifacts, susceptibility artifacts, zipper artifacts, array processing artifacts, and coil selection artifacts. We can have some more details about artifacts as follows. Wraparound or aliasing artifacts appears when the diameter of the scanned area is greater than the dimensions of the field of view used. A part of the image is folded on itself. Chemical shift artifacts appear at the interfaces between water and fat because the precessional frequency of protons is slightly different in these two substances. The chemical shift artifacts is commonly noticed in the abdomen, spine and orbits. Magic angle artifact is seen mostly in tendons and ligaments of knee joint that are oriented at a magic angle. Point artifact is seen as a bright spot of increased signal intensity in the center of the image. This is caused due to constant offset of DC voltage in the receiver coil, which after Fourier transformation appear as a bright spot in the center of the image. The slice overlap artifact is a name given to the loss of signal seen in an image from a multi-angle, multi-slice acquisitions, as is obtained commonly in the lumbar spine. If the slices obtained at different disk spaces are not parallel, then the slices may overlap. Second part is resolution. The resolution is the size of the individual pixel, 2D, or voxel, 3D. The smaller the pixel or voxel, the greater the resolution. It is intimately related to the field of view, the matrix size, and the slice thickness as shown in the equation. Pixel size equals field of view / matrix. And voxel volume equals field of view / matrix, x slice thickness. About the matrix size, the matrix size is the number of pixels in the images. Increasing the matrix size will increase the number of pixels in the image, but, as they are still within the same field of view, they will be smaller. To increase the matrix size, we can increase spatial resolution. Smaller pixels or voxels means better detail, or decrease signal. There are fewer photons per voxel, so the signal is less. Last but not least, we can increase scan time, so more voxels need to be acquired. Note this is only in the phase encoding direction, as each voxel requires a new signal, that is, more voxels means more signals need to be created. About FOV, FOV determines the size of the area to be imaged. A larger field of view means a larger area imaged. The matrix size remains the same, and so, to fill up a larger area, the voxel becomes larger. To increase the FOV, we can increase the signal. A larger voxel means more signal received per voxel, or lower resolution and increase viewing area. About slice thickness, we can increase by increasing the signal, decreasing the resolution, increasing the partial volume effect, or giving larger object coverage. Third part is signal-to-noise ratio, or abbreviate as SNR. SNR is a useful concept in every modality of radiology. There is always background noise in X-ray, CT, and MRI. To get a useful picture, the amount of signal from the thing being imaged should be greater than the noise. A higher SNR means a better and more useful image. The greater the size of the voxel or pixel, the more signal there is per point in the image, improving the SNR. However, a greater voxel or pixel means each point in the image is larger and the resolution is lower. The last factor impacts image quality is contrast agents. If we are suspicious about an infection or any type of cancer, contrast is very helpful. We can make a much more accurate and quicker diagnosis. After injecting the contrast agents, we see where they go inside the body, following blood vessels, and come to the specific tissues. That makes cancer or an infection much more obvious and apparent. Some people feel a generalized heating sensation going up their arm. Some people feel cool sensation. Some people experience a metallic taste in their mouth. Some feel no sensation. Although concern is always understandable and we need to be extremely cautious and careful, contrast agents are critical to diagnose illnesses. And how it works. The contrast agents have two types, which are positive relaxation agents and negative relaxation agents. Both of them affect the relaxation time of photon. Positive relaxation agents can reduce relaxation time T1, increase T2, and shows increased signal intensity on T1 weighted images. The gadolinium chelates and paramagnetic agents are examples of positive relaxation agents. On opposite site, negative relaxation agents can reduce relaxation time T2, increase T1, and shows increased signal intensity on T2 weighted images. Ferromagnetic and supermagnetic metals are examples. Nowadays, there are many agents used in clinical practice, but the most popular is Schering Magnevist, or we can call GD, DTPA. FDA has approved 3 agents. One of them is Schering Magnevist mentioned above. Others are Omniscan GD-DTPA BMA and Prohance GDHP-Do3A. Even though being used popularly, tissue-specific agents of MR contrast are yet to be standardized. New contrast agents and usage standards are under development, with the most promising being for many kinds of organs imaging. Thank you for watching. Wishing you good health and complying with the 5K regulations of the Ministry of Health for a no COVID-19 future.